Okay, so first of all, thank you to everybody for being here for what's going to be a very exciting talk. I've been looking forward to this. My name is Navraj Sadhu. I'm a psychiatrist practicing in Montreal, Canada. I'm originally from Vancouver on the other side of Canada, the West Coast, and that's where I did all my most of my training. Did my psychiatry training in Toronto, and now I live in Montreal. So I'm just a general adult psychiatrist. I work here, but I have an interest specifically in psychosis and particularly in psychotherapy for psychosis. So metacognition, acceptance and commitment therapy, mindfulness for psychosis. So it's very much my pleasure to be moderating this talk by Dr. Moncrieff, because it's a topic that's very close to my heart. And so I just want to say thank you to everyone for being here. So I'm just going to go and read a short description to introduce Dr. Moncrieff, and you can. And I also have a question for you, Joanna. I've heard Moncrieff and Moncrieff. Oh, sorry.
Muted. Moncrieff.
Moncrieff. Okay, all right. Okay, so Dr. Moncrieff is a professor of critical and social psychiatry at the University College in London, and also works as a consultant psychiatrist in the NHS in London and in a community mental health team. She has researched and written about the overuse and misrepresentation of psychiatric drugs, and about the history, politics, and philosophy of psychiatry for more generally for several decades now. She's been a leading UK government-funded researcher on reducing and discontinuing antipsychotic drug treatment. That would be known as the RADAR study, and collaborating on a study to support antidepressant discontinuation. In the 1990s, Dr. Moncrieff co-founded the Critical Psychiatry Network to link up with other like-minded psychiatrists. She has written numerous scientific papers and several books, including A Straight-Talking Introduction to Psychiatric Drugs, from PCC Books, and published in September of 2020, as well as The Bitter Pills, The Troubling Story of Antipsychotic Drugs, which was published in 2013. And finally, The Myth of the Chemical Cure, a book that was published back in 2009. So she's going to be speaking up today. The name of this talk, as you all know, is Busting Myths About Psychosis and Antipsychotics. Okay, so without further ado, I'll pass the mic over to you, Dr. Moncrieff.
Thank you. Thanks for that introduction, and welcome everyone. It's a pleasure and an honour to be speaking to you all tonight, or today, wherever you are. Yes, so I'm going to be trying to bust some myths about psychosis and antipsychotics this evening, and talking a bit more generally about antipsychotics and how we use them, and I hope there'll be plenty of time for discussion as well. So the first myth I want to look at, as Navraj referred to when he was summarising my talk, is this idea that psychosis, or what is sometimes called schizophrenia, is a progressive degenerative brain condition. So this, of course, originates with the ideas of Emil Kraepelin in the late 19th century, who coined the term dementia praecox. And he was essentially characterizing a condition that he had observed to be progressive, to involve progressive deterioration. And anyone who didn't fit that pattern basically didn't have this label of dementia praecox. So it was defined as something that was progressive. But even back then, there were people who had other ideas, such as Eugen Bleuler, another influential psychiatrist who was the first person to coin the term schizophrenia. Bleuler, despite coining that term, which has since become associated with Kraepelin's dementia praecox idea, actually believed that not everyone had a chronic cause, and that many people who had this condition that he called schizophrenia could recover, and some after only a single episode. But Kraepelin's ideas were very influential and really continued throughout most of the 20th century. And when people, and inspired people to look at the brains of people who were in the old psychiatric institutions and who'd been labelled with these conditions. And these studies started to show that people who had a label of schizophrenia seemed to show some differences in their brains from people who didn't have such a label. So here's a typical picture from a pneumoencephalogram. These were this was a technique where they injected air into the cavities in the brain and then imaged the cavities, imaged the air in the cavities in some way. And what they found was that the cavities in the brain, the ventricles, were slightly larger and the brain matter was slightly smaller in people who were diagnosed with schizophrenia, supposedly. But actually, there were lots of problems with those studies, even though they have subsequently been referred to again and again as showing that people with schizophrenia, and I apologise to this sort of audience for my language, but I will just use this instead of keep saying people diagnosed with or labelled with schizophrenia, but that was the term that was used at that time. So these studies that are quoted as showing that people with schizophrenia had abnormal brains long before there were treatments that might have affected them are not actually as robust as they are thought to be. First of all, the people who were going in for these studies were patients who'd been in the old asylums for many years and who'd had numerous different sorts of treatments that would have affected their brain, including ECT and insulin coma therapy, and lots of drugs, albeit not antipsychotics at that time or prior to the 1950s. Then, moreover, most of these studies actually didn't have a control group, so they were just looking at the brains and thinking, we don't think this is quite normal. In fact, the only comparison I could find with non-patients showed no difference. And there was another study that was done between patients with different diagnoses, which also showed no differences. So these studies do not confirm, as they are sometimes thought to confirm, that people prior to the era of modern treatment had abnormal brains prior to without having received any modern treatments. Then there are studies in the 1980s when CT scans were introduced that also seemed to show that people diagnosed with schizophrenia had different sorts of brains from normal controls. And these studies did involve people who were control subjects who didn't have a psychiatric diagnosis. But they still involve people who were almost all treated with psychiatric drugs on a long-term basis. And in fact, many of the people in these studies had also had ECT or insulin coma therapy or other sorts of treatments. Now, one of these studies by Owens et al., published in 1985, which showed, along with the other studies, that long-term patients with a diagnosis of schizophrenia or manic depression had smaller brains and larger brain cavities than patients who had a diagnosis of a neurotic condition, included 8 people who were not treated with antipsychotics or other modern drugs. And again, this study is therefore quoted as showing definitive evidence that people with schizophrenia have different sorts of brains. They were only 8 people who were not on long-term drug treatment in this study. So really that is far too small a number to show anything at all. Post-mortem studies of people diagnosed with schizophrenia have also been quoted as showing evidence that people with schizophrenia have abnormal brains. These studies, which were reviewed by Harrison in the late 90s, but had mainly been done in the 70s and 80s, again show that people with a diagnosis of schizophrenia had smaller brains and larger brain cavities or ventricles. But again, everyone in these studies had been heavily treated with drugs, including antipsychotics, for many years. Some of these studies, interestingly, find evidence of gliosis in the brainstem and the striatum of people who were taking antipsychotics, and gliosis is often thought to be an indication of some sort of brain damage or injury. So there were lots of confounders in these early imaging studies: drug treatment, other brain-based interventions, people who had a diagnosis of psychosis or schizophrenia, and the normal controls might not have been comparable in terms of IQ or cognitive functioning, and of course they were institutionalized, and therefore their lifestyle and the stimuli they were receiving were impoverished. So that message that people with schizophrenia had different sorts of brains was a strong one throughout the middle period of the 20th century, but there were other people putting forward other points of view. And one interesting study was conducted by Manfred Bleuler, who is the son of Eugen Bleuler, who coined the term schizophrenia. And Manfred Bleuler did a long-term follow-up study of patients who were admitted to a hospital in Switzerland between 1942 and 1943. And it's a shame that this study isn't known more widely, and possibly it's not known because it was written up in a very dense, very long monograph. But he found that 22% of his patients, and this is, of course, is a period that's before any modern drug treatment is available, made a full recovery, and 58% made an initial recovery and then had further episodes interspersed with periods of remission. But maybe the most interesting thing he finds, and he only refers to this qualitatively, he doesn't have statistics or anything to show it, but he comments that those who avoided long-term antipsychotic treatment seem to make a better long-term recovery. So there's someone saying that back in 1974. Other ideas about the outcome of schizophrenia were around in this period. There was a famous book written in 1985 by a psychiatrist called Richard Warner called The Outcome of Schizophrenia, and he looked at the different outcome studies that had been conducted over the course of the 20th century, and he found that outcome depends on lots of things, particularly on how you diagnose the condition, how you assess it, and particularly on the social and economic conditions that pertain at the time that the outcome study is done, so that when there is a buoyant labour market, for example, with a need for workers, the outcome of schizophrenia appears to be better than than at times of economic recession when more people are out of work. He also found that that between 20 and 30% of people seem to be making a full and sustained recovery in studies since the 1920s, and that this proportion did not vary according to the sort of treatment people were having. And although in the mid-period of the 20th century, possibly because of fuller employment levels, recovery improved, towards the end of the 20th century, it actually got worse again. So through the mid part of the 20th century, there were these two ideas going on. There was the idea that schizophrenia was a brain condition, that people had abnormal brains and that this had been shown in imaging studies. But there was also this other idea that, that the outcome of schizophrenia, in fact, could be positive and was more related to social and economic conditions than to interventions on the brain. But then in the 1990s, there's a strong revival of the idea that schizophrenia is a neurodegenerative condition. And this is the language that starts to be used. And it's kicked off by this paper published in 1991 by someone called Richard Wyatt. And this paper really gets the whole early intervention in psychosis movement going. And if you read the paper, it's quite incredible that anyone could really have given it that much credence. It's a review of various outcome studies, and it's not a systematic review. The studies are just selected according to what he feels like citing. And he said, but on the basis of the studies he reviews, he suggests that people who were psychotic for longer had worse outcomes. And therefore, he concludes that psychosis has long-term toxic effects and is a biologically toxic process.